Why is changing gun policy so difficult? Maybe it's good to start with some good news, right? To begin on a more positive note. And there actually is maybe a surprising amount of good news on this topic. Even since the Newtown shooting, you'll see that in 2013 alone, 15 U.S. states, representing about 44% of the population, strengthened their gun laws. If you include 2014 and 15, the number is now more than 20 states with major new laws. The number is even higher if you count more minor laws, and you can see some of the states, just some that acted there. And as I say, these are not insubstantial laws that states enacted, including licensing buyers, expanding background checks, banning weapons and people. So there has been success. So I'm going to start with the conventional explanation for why change hasn't happened. But I'm actually going to move away from the conventional explanation pretty quickly because the conventional explanation is easy. That doesn't mean it's wrong. By labeling this explanation conventional, I don't mean to imply that it's not an important explanation. But I think that there are many other explanations, maybe some that are more relevant to a public health audience that I especially want to cover. So the conventional explanation, the power of the National Rifle Association. If you go to their website, they claim nearly 5 million members. It's not crystal clear because there's no one counting, there's no auditing, right, whether that's really true. And the number has sort of bounced up and down over time. For many years, though, the NRA was more like what you might imagine a group like that would be, which was more of an enthusiasts organization. But beginning around 1975, they established the Institute for Legislative Action, the NRA-ILA, and became much more active in politics, and in particular in opposing virtually any kind of gun policy. They actually supported the 1968 Gun Control Act, which, as it sounds, is the sort of bedrock federal gun law, but things really took a shift in 1975. And so the conventional explanation goes that NRA members are deeply supportive of the position that they support, if you prefer, deeply opposed to most gun laws, and whereas there is broad public support by comparison, that deep support trumps the broad public support. And one way that it's helped to trump that broad public support is the state of campaign finance law in our country, or if you prefer, the lack of campaign finance laws in our country, strengthen one issue groups like this. Who's actually dying of gun violence? So here's the U.S. firearm homicide rate for all ages and all genders in 2013. It's about 3.5 per 100,000. And PowerPoint will do a neat thing for you if you want to graph more than one thing on the same slide. It will tinker with the y-axis for you, which is very helpful. So good on you, PowerPoint, right? So here's white males, or if you prefer, I could have labeled this bar the majority of members of Congress, right? So their rate of dying from gun homicide is a little bit less than the rate for all ages and genders, but same order of magnitude. If you then add in young white males 15 to 24, again, notice what's happening to the scale on the left axis. Notice how the blue and red bars start to look less meaningful, start to shrink a little bit when you start adding in white males, and you all can probably figure out where I'm going with this already, right? When you add in black males, again, the scale changes, and the blue and red bars start to look tinier. That purple bar, now we're talking about 27 or so per 100,000. And then finally, if you add in black males ages 15, yeah, you're supposed to gasp when I do this. When you add in black males 15 to 24, my gosh, the bars for white males members of Congress, start to look insignificant by comparison. And I have to ask a rhetorical question. Who among us really believes that if black males, or even, if white males, or even young white males were dying at the same rate from firearm homicide as young black males, that we wouldn't have done something by now? What's the leading cause of gun death in the United States? I've just shown you something about homicide, but actually it's suicide. Maybe that surprises some of you all. This is the pie chart of the 33,000 gun deaths that occurred in the United States in 2013. That's the most recent year for which we have final death certificate data from CDC. And you can see in blue, almost 2/3, 63 some odd percent of the gun deaths are suicide. It's a remarkable figure. It's actually the case that there are more firearm-related suicides. There are more suicides committed with a firearm than there are suicides committed with every other method combined. It's about licensing of gun dealers at the state level. And so let me start by asking you, you didn't think you'd be asked this particular question: how many states license professional hair cutters? And it's important, right? I mean, they can do major damage to you. I mean, you know, if you get an unlicensed hair cutter. So how many states license hair cutters in the United States? Well, all of them, right? Thank God. So you know, that's why your cosmetologist displays that little license. So how many states license gun dealers as a matter of state law? Just again 18. And look at all that white space in the middle. How about the number of guns in circulation? This is a reason that people raise with me all of the time. They say, my gosh, there's so many guns in circulation. Whatever we do can't possibly make a difference. There's a sense of futility or fatalism about guns. By the way, how many guns in civilian? How many million guns in civilian? The number of question marks there should be a clue, right? So there's 300 million guns in civilian hands in the United States. That's one for approximately every man, woman, and child. But actually, and despite the difficulty of conducting this kind of research, there's a lot of evidence that laws can keep guns from dangerous people, can make it harder. Criminals, for example, again, research conducted here that Daniel Webster and a postdoc were involved in some years ago show that actually criminals prefer newer guns, for example. Just a handful of what I think of as some principles here that not just the public health community can apply, but that we can all apply. The first is we have to resist this notion of fatalism, that there's nothing that we can do. I was just reminded by a colleague at CDC, actually, that Bill Foege, who used to be the director of CDC many years ago, said that optimism was one of our most important tools within public health, believing that we can actually make change here. Public health is about the long view, obviously. If you are expecting to make change tomorrow, you're likely to be disappointed. But if you're going to take the long view, then you might as well have big ideas, right? You might as well go for big change. So there's a place where I think public health doesn't always in this area. I'm not speaking now about our school, but maybe some others. It doesn't always succeed. That is more willing to go for small victories when what we clearly need are some bigger ones, at least in addition.